Continence care matters. In Leeds teaching hospitals, a 30-bedded ward for older people uses approximately 3,000 incontinence pads a month. While use of pads can be appropriate, over or inappropriate use can have a wide range of consequences for our patients, including skin damage, loss of dignity, and can potentially worsen mobility and function during a patient's hospital stay.
Once a patient suffers moisture-associated skin damage, they are 5 times more likely to develop a pressure ulcer. We want to do everything we can to support patients to regain or maintain bladder and bowel control to enhance their independence and quality of life during and after their hospital stay with us.
We should also consider the impact on our environment. A large incontinence pad has a carbon footprint equivalent to driving a petrol car 1 kilometre, and they can take 500 years to degrade. For just one older people's ward here at Leeds, incontinence pad usage per year equates to a carbon footprint of 200 round trips from Leeds to Scarborough and has a product cost of £8,000.
We are working with patients, staff and researchers to reduce inappropriate pad use, using interventions based on behaviour change theory. We know from our research that patients often worry about having accidents or asking staff to help them to the toilet. And we know staff feel anxious to protect patients' dignity and worry how to discuss sensitively with patients asking for pads.
We understand staff are busy and don't want patients to be incontinent or fall. But by focusing on continence care for each patient, we can promote independence and dignity, alongside reducing falls and skin damage. Pads shouldn't be a first-line option. Instead, we should promote toileting where able. To achieve this, it requires a collaborative team effort and regular conversations with patients, identify what their needs are, discuss continence concerns daily as a ward team, and review outcomes at handover.
Blood and bowels are everyone's responsibility. We know clinical time is pressurised, but getting this right can make a real difference to a patient. Is a pad necessary? Please use the urinary and fecal incontinence care plan to ensure individualised care. If a pad is needed, did you know that the pad formulary is available within the Trust? This helps you to use the appropriate product. One size does not fit all. Start from the smallest one, absorbency-wise, and work your way up. If necessary, if a patient asks for a pad, please take a moment to advise regarding alternatives and support with options available.
We would like to thank our staff for already improving continence care together. We want our patients to be empowered with best continence practices and appreciate that incontinence pads are really the last resort. We have the first in-hospital continence specialist team in the UK to support you. Think bladder and bowels and take appropriate action for each patient.
We want patients and their carers to feel comfortable talking about continence-related issues with our staff.
We are passionate about patient safety and ensuring evidence-based practice, alongside doing our bit for the environment. If we reduced large incontinence pads use by 25% on our wards, that could save per year for each ward £2,000 and 50 round trips Leeds to Scarborough.